To not give a healthcare worker some cool off period after a burnout of 14 days is very unethical. It is taking a toll on the mental health of the healthcare population at large, and a mental epidemic is under the wraps. It is going to uncover very soon. Having no quarantine for a resident doctor who has worked in the COVID facility for a duration of 2 weeks is very absurd, because that this virus has an infectivity which is even much higher than the Delta variant, which was so notorious in the second wave. We might contract this virus even with all the protective equipments in place. Even after contracting this virus, say, they're not taking into account the very basic nature of the disease. There is a window or a latent period during which the virus will multiply and will cause symptoms after you have contracted the virus. So there is a latency of around 24 to 48 to 72 hours. Asking the healthcare workers soon after their COVID duty to go and work in the community is not only putting those populations at risk, but also putting the healthcare workers' family at risk. Many healthcare workers who have lost their near and dear ones in the second wave, and their family members are just too afraid. Anybody who has been trying to, not get the virus with all the protective measures, we are putting them at risk.
First wave and second wave, we were given a 14-day quarantine break. But nowadays what has happened is, because of lack of doctors, we have not received our juniors. Juniors are also going for examination. This way, there's a huge burden on the second years, which are the only ones who are working right now. There have been times where we have been working for about a month a stretch, because we don't have enough number of doctors, we don't have enough number of facilities. Going through all that COVID first wave, second wave, and now the third wave, it is really exhausting for us. Exhausting both physically as well as mentally, because we have to be there with the patients and has a mental toll on our well-being. Naturally, we all need a break, we all need a cool-off period during that continuous duty hours. That is very least expected out of everyone.
We are being asked to enter the community the very next day, which is very risky, both for the community around us, for the near and dear ones around us, and for the patients whom we will go and serve the next day. So we wish and hope that the respected government and the Ministry of Health and Family Welfare will take some necessary steps in this regard, so that doctors and patients can go on in kind of a symbiotic relationship and have the best possible outcomes as far as everyone is concerned.